right, good afternoon, everyone. Thank you for being here today. After listening to President Trump last evening and listening to Governor Wolf's news conference today, we collectively, as a community, wanted to address COVID-19 specifically as it pertains to Erie County. We continue to stand as a united front here in Erie County, working together to keep all of our citizens and the visitors to Erie County safe. As you can imagine, each one of us up here and our staff have been fielding a lot of questions and subsequent rumors. So it's important to note that as of today, no cases of COVID-19 have been identified in Erie County. I want to repeat that. No cases of COVID-19 have been identified here in Erie County. Specimens have been collected, but all tests thus far have come back negative. We are working diligently every single day to be proactive in planning and preparation for what steps need to be taken if and when COVID-19 arrives in Erie County. Today, the governor recommended postponing or canceling any event in Pennsylvania with an attendance of 250 people or greater. And we are recommending that we in Erie County follow the advice of the governor. At this time, though, we will leave the decisions about events up to the discretion of event organizers, and we encourage all citizens to make personal decisions as to what they do attend and whether they attend an event or not. While no cases have been identified in Erie County, out of an abundance of concern, collectively we have spoken with the organizer of the St. Patrick's Day Parade, who has decided to cancel this event from the governor's recommendations and from the discussion with those of us collected here. At the end of our news conference, we will be opening up for questions. In addition, we will be posting a fact sheet with frequently asked questions to eriecountypa.gov. We will post it also on Erie County social media pages, and I'm sure many of these other organizations will be posting it also. So now I would like to invite Melissa Lyon, the Director of Erie County Department of Public Health, to the podium.
At 4'10", the microphones can look a little intimidating. So I'm really here today to tell you and reinforce the conversations that we've been having that we do not have any cases of COVID-19 in Erie County. There are 22 cases within the state. Those are posted on the State Department of Health's website as routinely as possible, that they're able to update those. The highest concentration of those cases are in Montgomery County, which is why the governor came out today with his recommendations. He made those recommendations as well statewide for us to take into consideration, which is why we're here discussing with you today. One thing I wanted to talk about with you is how you have a county health department in Erie, Pennsylvania. There are only 10 health departments throughout the state of Pennsylvania. So with that, you have additional resources that are working day in and day out to respond to community questions, to assist the physicians and the healthcare systems on what they're doing for patients that are calling them. And the decision making that happens is happening collectively with the Erie County Department of Health. We have meetings every morning from 8:15 until whenever we're done. During those meetings, we talk about people under investigation. We discuss calls that have come in throughout the day, throughout the evening, emails. So we have a really well-working machine that is assisting our stakeholders. Moving forward, we're going to have conference calls at 8:30 in the morning, and those calls will update everyone if anything has changed over the weekend or if there is important information that we need to get to the media. On Mondays, 8:30 on Monday mornings. Those are conference calls. Thursday afternoons, 1 o'clock, we will be having a panel discussion here in the courthouse on the 5th floor, right in this room, and we will be having healthcare providers with us, as well as public safety, Erie County Department of Health, and other government officials as we see fit to help answer any questions that come forward, as this is a rapidly changing environment around COVID-19. Thank you.
Thank you, Melissa. And now I'd like my partner here in county government, Judge Priscilla, President Judge, to say a few words about the court side of county government.
Well, good afternoon, everyone. So as you can see, this is quite a collaborative effort. We have a lot of faces here representing all aspects of county and city government. We want to thank our county executive for taking a leadership role here. Our assistant Gary Lee has done a wonderful job, and our mayor, of course. We're all trying to get this right. So let me just tell you and fill in some gaps about the court system and why I'm here. Right now, we're keenly sensitive to what's going on, especially after being declared a pandemic. Now, how does it affect the court system? Well, we're acutely aware that we're in the middle of a trial term. So what that envisions is 150 to 200 jurors a day coming down in very close quarters, okay? So mindful of that, we have looked to Montgomery County, as Melissa has referenced. I think there are 13 now. And their president judge has come up with a plan that serves as a blueprint for us. So our first concern obviously is assuring public health and safety. But you also have to keep in mind there's a delicate balance here of certain defendants who are charged and have rights also, for example, in the criminal system, to a speedy trial, and making sure their cases are heard on a timely and constitutional basis. To that end, what we've done first for jurors coming down, tomorrow being Friday, we don't have the need for jurors. But then each day next week, we will make assessments. And one of the examples would be, instead of calling 150 or 175 or 200 jurors, we're calling 90 because it meets the needs of the trials that are scheduled. Then those that appear, instead of keeping them in the close confines of our jury registration room, we're going to utilize our ceremonial courtroom, courtroom H, which gives a little more expanse for that social contact, that safe distance. We're going to utilize the jury room and other courtrooms to maximize the space. Of course, common sense ideas like adding hand sanitizer throughout the halls and in the courtrooms was a no-brainer, and we've been doing that, so we want to certainly thank Building and Grounds for doing that. Then, of course, because of the types of cases we hear down here, as a court of general jurisdiction handling several matters, this has a ripple effect. For example, adult probation, custody, domestic relations. We have been in touch with our organizational leaders of those departments and talking to them to see if there can be something done in the alternative to the actual in-person contact. For example, telecommunication, whether that's a telephone interaction, a video conference. So we're working our way through the system on that day. This is fluid, but again, I'm very buoyed and encouraged by all the support we have. We're taking it very seriously. As much as we can, we're trying to stay in front of it, but as you know, this changes really hour by hour. So I want to thank every one of you, and certainly my colleagues, for their support.
Thank you, Judge Trisilla. And as the judge said, what we are trying to do collectively is to mitigate what has happened in other places across the world and even in our own country. And I think we're working hard to do that. I'd now like to ask the mayor to come up and say a few words about another issue that's very important to the two of us, but that it could also be affected by this COVID-19 pandemic. Mayor?
Thank you, Kathy. First, I just want to say how lucky we are with the great team we have here in Erie and the way we all work together. I'm very impressed, Melissa, by your team. We've been working closely with them for a couple weeks now at City Hall. We talk to them every couple days, and if we have a question, we go to them, and we actually have a weekly meeting set up as well. That happens at every conference call every week. So we really appreciate all the help there. The thing that Kathy asked me to talk about just a little bit is the census, the 2020 census. And if you have to stay in your house and not go to meetings or parades or things like that, something you can do is complete the census. You can do it online, you can do it by phone, you can do it by mail. You don't have to talk to any other people or be touched by any other people to do it. This is very important. The census is, I think, the most important thing each one of us has to do this year. This spring, actually, it has to be done, no later than July 31st. You can start doing it now. It affects three things. One is the number of electoral college votes Pennsylvania has in presidential elections. Another is the number of congressmen Pennsylvania has in Washington, D.C., in the U.S. Congress. And third, and probably the most touching thing, is how much federal money we get. For every person that doesn't report, we lose $2,100 in federal funding. Every person that's not reported to the census. There's an estimate by the US Census, actually. They did an estimate that this year they expect Erie County to be undercounted by over 500,000 people, 50,000 people. More than 50,000 people will not be counted. If that happens, over the next 10 years, Erie County will lose over $1 billion a year in federal funding. And this is money that goes to the neediest people in our communities to help them get a hand up. So I ask you all, while this COVID-19 is going on, don't go outside, don't be with other people, get your census done. Thank you very much.
Thank you, Mayor. And I think that we should also realize that healthcare funding is also dependent on the census. And as we look at the funding that will come in to help us in cases like this and others, we want to make sure we get our fair share of the funding. So we as a community know that so many people are concerned about events, and that really is one of the questions we hear the most about. Should we go to an event? Should we have our event? In an abundance of caution here in Erie County government, starting on Monday, I'm banning county employees restricting their travel for any non-essential to the functioning of their position travel. So they can, obviously we have county employees who need to travel, sheriffs who need to travel to pick someone up, OCY workers who need to go out and visit a home and check on children. But if the travel is not essential to the functioning of their job, that will be banned for Erie County employees as of Monday. I'd also like to reiterate the importance of all of us doing our part and taking the simple precautions of washing our hands and singing happy birthday twice while we do it to make sure that we've washed our hands completely and thoroughly. If you don't have the ability to wash your hands, use hand sanitizer in the meantime until you can get to a place where you can wash your hands. Avoid touching your face. It's a very difficult thing to do, and as soon as we say that, everybody wants to touch their face. But it's something simple that we can all continue to remind ourselves and remind those we're with. We have to stop shaking hands. We love to hug each other here in Erie County. We all have to think twice about that. It was a problem even when those of us got together just a little bit ago, because it's innate in us to reach out our hand and shake. So we all have to remind each other to not do that during this time. So try to have social distancing, especially if you are in any way compromised medically. Stay out of situations where you will be around a lot of other people. And last but not least, if you are sick, if you do have the symptoms of a cough, a fever of 100.4 and above, or shortness of breath, those three symptoms, or any of those, call your family physician. I suggest we start all using telemedicine, which hopefully most of us have the ability to use, or call, any way that you can call your physician. You can call your insurance company, find your way to a nurse or a physician. They will guide you through this entire process and tell you what to do. Because if you are sick and you show up at one of our urgent care centers or one of our hospitals and they don't know you're coming, you could infect a number of other people if you actually do have the COVID-19 virus. If you don't have insurance, you can call 877-PA-HEALTH, 877-PA-HEALTH, and that's an important number for those in our community who do not have health insurance and have inability to pay for a doctor's visit. As you can see, we have a lot of representatives up here. Emily, do you want to come up and represent UPMC? So we have UPMC represented. We have Dr. Clark here from St. Vincent's Hospital, and we have Father Rubino here from LECOM, as well as Brian Maceros, who is with our Public Safety Emergency Management. Gary Lee, my Director of Administration. You already saw the judge and the mayor, and Melissa Lyons. Last but not least, well known to our general public, Shar Behringer, who's been really leading a lot of our medical efforts from the county health department. So at this time, I would like to open up to questions that you might have for any of us collectively. I know we often do one-on-one, but I think if you can ask some general questions from the media or even from anyone else here in the room, it might help all of us to have those questions answered.
Kathy, have you talked at all with any of the religious leaders in town? One of the things the governor talked about at the 2 o'clock press conference was, seeking guidance about large congregations gathering at churches and synagogues.
We have not had those conversations yet. As was mentioned, this is a fast evolving process. The governor's conference was just at 2 o'clock here this afternoon. Again, gatherings of 250 or more are discouraged. Some of our churches are quite large and may have that many people in it. I know in the Catholic Church, they have stopped shaking hands at the handshake of peace. They have stopped serving communion with the blood, the precious blood, and so I think other churches have made similar type changes. Again, we love to hug each other, especially at church where we know each other very well. We need to all stop doing that.
You said that all specimens collected have come back negative. Would it be possible at this point that you've collected a specimen for which results have not come back so that you could have a positive case and not know it? And also, how many specimens have you collected? How many people have been tested?
I'm going to allow the health department to answer that question.
No, we have said pretty consistently that we're not going to release the number of persons under investigation. It really doesn't add any value to the community to release that information.
How long does it take for a test, though, for results to come back? I'm just curious as to whether or not you could have tests out right now that could eventually come back positive.
Okay, if tests are sent to the Pennsylvania Department of Health Laboratory, once they receive the specimen, turnaround time has been 24 hours. It's been very good there. There's now the opportunity to use commercial labs. Commercial labs, it's going to be taking longer. It's going to be a 3 or 4 day turnaround.
And just one very easy question for you. Can I get you to say and spell your name just so I have it?
Charlotte, CHARLOTTE, Behringer, BERRINGER.
Other questions for this group up here? Well, if there's none, I want to thank you all for coming. Oh, yes.
If you were to find somebody, if we eventually ended up with a case, what would procedure be there? Would it be a stay-at-home kind of thing or a stay-in-the-hospital sort of deal?
Okay, again, we'll bring the expert.
Okay, this is a great opportunity to define 2 words that are probably new to most people's language. First word is isolation. Isolation is what would occur when someone is diagnosed, confirmed COVID-19 disease. And we really need to say COVID-19, not coronavirus disease. We need to say COVID-19. Coronaviruses are a whole class of viruses that cause other illnesses. We are talking solely about COVID-19. So if someone is tested positive for COVID-19, we are notified of that at the health department. That person we would be speaking with that person would be put into isolation. If they're ill, it would be in a hospital. If they're very ill, if they can be discharged home, then that isolation would be in their home. That's for the duration of the illness and until they have 2 negative specimens afterwards. Now the second word is quarantine. Quarantine is what would happen for people who were exposed to a confirmed case, or that's what's happening to some of the travelers who are coming back from level 3 countries. That's where they are basically asked to stay in their home for a 14-day period. Do not go to work, do not go to church, do not go to school. Generally keep to yourself for that 14 days. So there is a difference between isolation and quarantine. Okay. Jim?
If someone comes down with the virus and they are receiving treatment, generally how long does it take for them to recover once they get it? I know there's obviously going to be a range depending on your health. Typically, a relatively healthy person gets the virus, how long are they hospitalized for? How long do they feel they can't be around other people?
Okay. The question is how long does someone stay ill once they become ill with the disease? And that's really going to vary pretty widely, because right now we know that 80% of the people who contract the virus that causes COVID disease, 80% of them are not ill enough to want to see a medical provider. So chances are those people are going to feel better a whole lot more quickly. We don't know enough about the disease yet to really have the data on specific number of days. Now certainly if someone is hospitalized and they're on a respirator, that person is going to be ill a lot longer than someone who has had a much milder case of the disease.
Actually, Char, I have a question for the county executive and the mayor about working from home. I know, surprising. Any discussions about working from home for either county employees or city employees? Where do those discussions stand? I'd like to get an answer from each of you on that.
Well, in county government, we have begun those discussions. We have been working with our IT department to determine our capabilities. We believe we have the capability for many people to work from home. But at this point, we don't have any plans on closing county services. Many people depend on us every single day, and obviously we have some 24/7 operations that would not be able to close. But we expect, at this point, knowing what we know today, with no known cases in Erie County and hopefully mitigating the chance of any great spread in our community, that we will be able to keep functioning. But we may have some people who are able to and don't need to be essentially here in the courthouse, stay at home, and we're working towards that.
And at the city, we've talked about that any employee capable of working from home, we should allow to do that. Our problem is we have a large majority that, like for instance, police, fire, garbage collectors, street repair crews, none of them can work from home. So what tactics can they use to make sure they don't contract the virus in the course of their duty? So that's kind of, but anyone who could, like if they're in an office job where they can have their computer at home and a phone, there's no reason they shouldn't.
A question for both you and the mayor as well, both from a county and a city perspective. As you come up with your plans, as you watch the disease here, is there tipping points? If you build in these things where you say, if we get X number of cases, or if it gets to this county, is there a closeness range or a number of cases at which point you start taking more drastic measures? Are those built in, or is it a day-by-day kind of thing?
Yeah, I mean, I haven't been part of any conversations like that, and there's certain things like, we can't have all our police stay home, I don't think ever. I mean, so we have to find a way to do what we need to do, to keep people safe. Otherwise, I can't imagine what would happen if we say no police or no firefighters are gonna work, how many houses would burn down. So, I mean, we wanna do everything we can to keep our people safe. I don't know what the tipping point would be where something more drastic. I'm kind of feeling like what we're doing now is pretty drastic, given the situation we're in. Hopefully that's gonna prevent us from ever having to face that.
I think what we're doing is also trying to benchmark against what other communities who've already experienced this have had to put in place. What the governor has put in place for Montgomery County today is fairly drastic for the number of cases they have, especially if you compare them to maybe King County, Washington, and some of the other counties. But I think the governor's really trying to be proactive in stopping the spread of this disease throughout our Commonwealth. So we will work with our State Department of Health. Our health department is in contact with them all the time. They're giving us guidance, so it's coming from the federal to the state and then down to us, and we're trying to follow that type of guidance.
Hi, I would just like to reiterate again, I believe this is for Shar, so are you guys currently testing here? Do you guys have the kits?
Great, yeah, that's a great question.
Okay, another clarification. What we can do in Erie County is we can gather specimens that are then sent to labs, either the Pennsylvania Department of Health lab or a private lab, to be tested at the lab. Testing is not occurring here in Erie County, but we are gathering specimens to be tested for COVID-19 at our acute care facilities.
Shar, are all of the specimens right now, as of today, being sent to the lab outside of Philadelphia? Are any of them that you know of from Erie County being sent to private labs?
Some have gone to both.
Some have gone to private labs. Okay. Thanks.
I don't know if either one of our health facilities that actually does the specimen collection wants to address some specifics about that. Because only 2 of our healthcare facilities have the ability to get that specimen at this time, if I'm correct, right?
So this is evolving, much like all of this. By the way, since I've been given the opportunity, thank you for inviting me to represent the Allegheny Health Network and be a part of this. I really give a lot of credit to the leadership for the county, our county executive, and of course our mayor. So this is a very dynamic, very fluid process. But with regards to the question, David, the additional information I can provide is what's been introduced to the community now over the last day or so is the opportunity to do testing in the private lab space. And what that'll allow us to do as acute care providers is to increase access to testing. As a part of this, the management of our population in a epidemic, pandemic kind of a scenario, it's important to get our arms around the prevalence of the disease. And a way to do that is to do testing based on symptoms. Not everybody with these symptoms that we went through has or will have COVID-19. Quite frankly, I think we haven't said, we still are seeing a lot of influenza A in this community right now, and the symptoms are the same. Influenza A is very prevalent right now and is dangerous. So people do have consequences, complications from influenza A. So, but from an epidemiological perspective, it is important with COVID-19 to be able to diagnose it. And so what I just said is that commercial testing is now available, and all of the health systems will be introducing criteria and availability to that in a short period of time. And the other point to make about that is that not all testing will need to be done in the acute care setting. Because to this point, it's been the hospital emergency rooms, all 3 of them in Erie County, that have been doing the testing, and it's already been said that the test then is sent out of town. So commercial testing being brought closer to where patients will have more access in their doctor's offices, in urgent cares, will be an important step forward. And then one more thing I'll say is the importance of telehealth solutions that the health systems in this community do offer. So we do want to promote the use of telehealth to get questions answered, to have evaluations done, so that we don't overwhelm our doctor's offices either. I think this is really, really important in case this does become an issue in the future. Right now, we have not seen any and confirmed any cases, but we're trying to be as best prepared based on what we've seen in other parts of our country and across the world, so that we can control if this disease gets to Erie County.
Kathy, 2 questions from our Go Erie Facebook Live audience. The first is education. Did the governor or anybody from the State Department of Education address any kind of school cancellations? Do you know of any countywide school cancellations? And I have a second question.
The governor addressed Montgomery County, and that the schools will all be closing in Montgomery County, but that is the only county where this is occurring that we are aware of.
Is Erie County working with adjacent counties in Ohio and Eastern Ohio and Western New York on the health issues?
Yeah. So we typically have informal relationships with our neighboring counties in New York and Ohio. So that communication is more informal as opposed to a formal strategy on what that looks like.
As things are moving, maybe from, I'm not going to conject, but as things are moving, does that become a more important communication to have?
Yeah. So at a national level, we have what are called Councils of State Association for City and County Health Officials. Pennsylvania has a State Association of City and County Health Officials, so we have direct phone numbers to other states, and then from that we have direct numbers to their local health departments. So communicating with them could happen in a very short period of time if needed.
When it comes to events in the county, are you considering a blanket ban, or are you leaving that up to organizers and leagues, that sort of thing?
Because we don't have any cases here in Erie County and really none in Western Pennsylvania, at this point we are leaving the decisions on all events to the organizers of those events. All of this will continue to evolve as we see things happening. I don't know if anyone else wants to say.
UPMC or Recon?
Anybody else want to say anything?
No, I just-
Sorry, Emily.
Yeah, just to reiterate the point, we don't have any cases. We are rapidly developing testing capabilities. UPMC is a leader in terms of working with research in Pitt. So those, the testing will occur in Pittsburgh, but that will shorten the turnaround time for all UPMC hospitals that do the collection.
Emily, roughly how much of a turnaround is it right now at the Hammond ER for the test? And how much shorter do you think it'll be once the tests are sent down to Pittsburgh as opposed to outside of Philly?
Yeah, so the estimation right now is aligned with what Shar had mentioned. So once we get the collection and it is curried to the state, it's about a 24-hour turnaround. What we anticipate is at least cutting that time in half.
So from 24 to 12?
Yeah, we would have to curry the specimens to Pittsburgh. The testing would occur in a few hours, so that's a very conservative estimate. We would expect and hope that that would be faster.
Kathy, just from Tom's perspective, I want to thank the mayor and the county executive, the judge, for their leadership in pulling this community together. We obviously are pleased that we come to cooperate with them in any way we can. But I also think we have to look at this from a historic perspective. Generations before us, especially those in World War II, World War I, understood that they had to sacrifice for the common communal good. All of us love to be fiercely individual. I like to go here at the time that I choose. I want to go to this event, or I want to go to that event, or I want to go here and I want to do that. I think in the next 2 weeks, if we think of the common good and level that curve, we get through this. It's a bit of a sacrifice, but it's a sacrifice others made before us. And now it's our time to step up to the plate and say, use some common sense, use some sacrificial discipline upon ourselves for the common good. And I think we can do this. And we thank the mayor and the judge and John for calling us here
think that's really an appropriate place to end this press conference, and thank you very much, Father Rubino. And thank you all for coming out, and I most particularly want to thank all those here standing with me today, and really all the people that have been on the front line of this, and will continue to be on the front line of this COVID-19 pandemic until it is no more here in Erie County. So it's not here in Erie County, but until it's no more an issue here in Erie County. So again, thank you all, and we'll obviously all be here for questions if you have any.
Thank you, Kathy.
Yeah.